Hey guys! Welcome to Hot Health Trends. I'd like to talk to you about the amazing vitamin D. Today I'll be covering the following topics. Why vitamin D is important to maintain good health. The symptoms of vitamin D deficiency. The health risks of vitamin D deficiency. How your body produces its own vitamin D. The main causes of vitamin D deficiency. The best sources of vitamin D. Vitamin D-rich foods. And finally, the differences between vitamin D2 and D3. Make sure to watch this video to the end, it's one of the most comprehensive videos about vitamin D on YouTube. This information will aid you immensely in maintaining good health. Vitamin D is essential for keeping your bones and muscles strong. It may also prevent and treat muscle aches, bone pain, and osteoporosis by aiding in calcium and phosphorus absorption. That is also important for dental health and prevention of dental issues. Vitamin D also may help treat and prevent common colds, flu, and other infections by boosting your immune system. Vitamin D controls growth of normal and cancerous cells, so it is important for prevention and treatment of various cancers. By stimulating production of insulin in your pancreas, vitamin D reduces insulin resistance and it may be beneficial in preventing and treating type 2 diabetes. Vitamin D aids in treatment of some skin disorders like psoriasis. This makes vitamin D important to skin health as well. As vitamin D affects mood, it may prevent and treat some mood disorders like depression. It's also very important to brain health, and may treat and prevent disorders like multiple sclerosis, Alzheimer's disease, Parkinson's disease, and autism. Vitamin D may also be beneficial in prevention of high blood pressure, kidney disease, coronary heart disease, and heart failure. Vitamin D deficiency. Let's have a look at symptoms that may indicate that you are low on vitamin D. If you easily get sick with colds and flu, or have respiratory problems, you may have a compromised immune system, which can be caused by a low level of vitamin D. Lack of energy, chronic fatigue, depression, consistently feeling pain all over, joint pain, muscle weakness, low bone density, and skin conditions like dry and peeling skin, or poorly healing wounds, may indicate you are low on vitamin D. Vitamin D deficiency increases the risk of many chronic diseases, including heart disease, stroke, certain infectious diseases, type 1 diabetes, rheumatoid arthritis, Crohn's disease, and multiple sclerosis. Low levels of vitamin D can also increase your chances of dying of certain cancers like colon, prostate, breast, and pancreatic. The main causes of vitamin D deficiency. Kidney disease or kidney failure. The kidneys are the last stop where the inactive form of vitamin D is converted into its active state for your body to utilize. I will talk more about this a little later in the video. Other causes may be digestive tract issues like Crohn's disease, cystic fibrosis, or celiac disease. These diseases can prevent vitamin D absorption. A diet low in vitamin D-rich foods, or no daily exposure to sunlight will cause a vitamin D deficiency. People with a dark skin tone require longer exposure to sunlight to produce sufficient amount of vitamin D. For example, a person with dark skin may need 6 to 10 times more exposure to the sun when compared to a person with lighter skin. Sunscreen with an SPF of 8 or higher reduces the ability of skin to form vitamin D by more than 95%. Age plays a big role as well. The skin of elderly people produces only 25% of vitamin D as compared to the skin of a younger person. The 3 sources of vitamin D. The main source for healthy people is exposure to sunlight daily. The second is food rich in vitamin D. The last one is supplementation. How the body produces vitamin D. As previously mentioned, daily exposure to sunlight is the major source of vitamin D for healthy people. Vitamin D is, in fact, a hormone. Because cholesterol is a precursor for most hormones, it's a necessary component for normal levels of various hormones, including vitamin D. Provitamin D3 is produced in your skin from cholesterol. When you are exposed to type B ultraviolet rays, or UVB, provitamin D3 is converted into previtamin D3. In the final step, the previtamin is converted into vitamin D3. The D3 leaves your skin and enters your bloodstream. The vitamin is then carried to your liver by something called the vitamin D binding protein. Once in the liver, vitamin D3 undergoes a slight change in its chemical structure. After that, it is carried through the bloodstream to the kidneys where it goes through another change in its chemical structure. This is the active form of vitamin D. It is then carried by the bloodstream to various parts of the body, and exerts its action. Because kidneys are so important in converting vitamin D into its active form, you may not benefit from sunlight exposure if you have kidney disease. You may increase exposure to sunlight by going for walks with your family, friends, or pets, going bicycling, meditating outdoors, practicing yoga, tai chi, qigong, playing with your children outdoors, reading a book, or even starting a garden. Pick an activity you enjoy that can be done outdoors. Have some fun, while at the same time, get your body producing that oh-so-important vitamin D. Vitamin D-rich foods. Fish. For example, salmon, herring, sardines, and tuna. Also eggs, fortified milk, beef liver, and cheese. The third way to increase levels of vitamin D is taking supplements. It is the easiest and most people's favorite way. However, there are two types of vitamin D supplements out there: vitamin D2 and vitamin D3. D2 is the weaker of the two. Also, D3's half-life is longer than that of D2, which means it stays in the body for a longer period of time. Vitamin D3 comes from exposure to the sun and eating fatty fish. You get vitamin D2 from certain vegetables, or by prescription. Recommended daily dose of vitamin D. The recommended daily dose varies from one person to another. It depends on any health issues you may have, daily sun exposure, diet, and your skin tone. Though the recommended daily dose varies from 400 IU to 800 IU depending on age, I strongly suggest talking to your healthcare provider and getting your vitamin D levels checked. Too much vitamin D may also cause undesirable health issues. To prevent side effects, always discuss vitamin D supplementation with your healthcare provider beforehand. I hope this video was valuable to you. Please hit subscribe and turn on notifications so you don't miss our new videos. See you in the next video and have a healthy day.